The next presentation by Dr. Chen from United States. The title of the talk is an implantable magnetic breather pump for metronomic convection-enhanced delivery of biological agents in malignant gliomas. Please.
Thank you. I want to thank the organizers for inviting me to give this presentation. This is our continuing work on developing an implanted pump for delivery of biological agents. Sorry. This is our continuing progress report on building an implanted delivery pump for malignant gliomas. I want to say that I work at USC, but I also function as a consultant to Pharmaco-Kinesis, which is the company that's building the pump. And basically, I want to say that what's currently available for drug delivery of brain tumors. We have oral chemotherapy such as temozolomide available. We have intravenous chemotherapy such as Avastin and also for CPT-11. We have tumor wafers such as gliadel, and you've heard about convection-enhanced delivery. But in terms of convection-enhanced delivery, we all recognize the limitations of convection-enhanced delivery. It has direct delivery of drug into the tumor. The drug has to deliver usually 4 to 5 days, as long as 7 days, via an external catheter, and then has to be removed. And the drug needs to be infused again, and other surgeries needed for catheter implantation. The whole idea of convection-enhanced delivery, as most of you well know, is that it's a positive energy catheter is placed into the tumor, and via positive pressure, and the molecules are delivered into the tumor itself. So there has been some success in phase 1 and 2 trials, no clear success in phase 3 trials, and Neopharm and Transmit were some molecules that were companies that were involved in phase 3 trials that were not efficacious. The question then is the lack of success from delivery or is it from the drug? So what if we had a novel delivery device that could be implanted so that the medication is delivered continuously without reimplanting the catheter? What if this catheter could have metronomic continuous delivery? That delivery was adjustable so that it could be controlled externally, and that we have instant monitoring and feedback of how the tumor is doing with a physiological monitor such as vascular endothelial growth factor. We can minimize the side effects systemically of chemotherapy. We don't have to worry about the blood-brain barrier, and then we don't have to worry about first-pass hepatic metabolism. So this is our conception of this brain tumor pump that I'd like to show you a video of. Basically, this is so basically after the surgery is done, the pump would be implanted into the tumor resection cavity. And then you see how the pump is basically connected to a reservoir, so you can tap it. And then it's then connected via a catheter. And then the catheter is basically placed in the chest above the pectoralis muscle. And then within this pump, there's going to be 4 chemotherapy canisters. And then the chemotherapy is going to be delivered via the catheter right into the tumor. Now, in unresectable tumors, you can place a catheter instead, and the catheter will go with convection-enhanced delivery right into the tumor. So what I'd like to do is that now I'm going to present basically the rest of my presentation is talking to you about this pump in detail. So as you can see from the video, basically what we envision is 5 components to this pump: an intracranial pouch or catheter, a connecting catheter, a canister, a pump that has chemotherapy in it. This will be connected by a Wi-Fi station. The Wi-Fi can then control delivery of this chemotherapy, and then control the cycles that which is delivered. And then there's a lab on a chip that will detect VEGF levels. And so this is the intracranial pouch, goes in the resection cavity. There'll be spines that will basically penetrate and deliver into the tumor resection cavity. If the tumor is not resectable, a catheter will be placed, and this catheter will then be able to measure pressure, temperature, and pH, as well as oxygen. And this is how the schema would go. Basically, that there's a circulation pump, medication would come through and would go into the tumor, and then the catheter will also, as a double lumen catheter, then sump back, and then this will then be measured with the VEGF levels. So you can see with the cross section that there are 2 delivery pumps, 2 delivery lumens, as well as sensors within the catheter. And this is the pump itself, the canisters that are involved, and these will be powered by a piezoelectric pump. And this is the bellow system that's going to be responsible for delivering chemotherapy. As you deliver chemotherapy, you develop negative pressure, so the bellow system is needed to maintain constant delivery of chemotherapy. And what we envision for detecting VEGF is something called basically an implanted spectrometer. VEGF has absorption of about 280 nanometers, so a correlation absorption with concentration. And then later on, our lab on a chip is basically going to have VEGF aptamer that will basically be able to take the CSF, our tumor fluid around it, and also detect VEGF levels. And this is the Wi-Fi communicator that will have a direct communication with outside. And currently, basically, what we have done at the status that we're at is that we are in the process of miniaturizing this pump. But what we have done is essentially built a benchtop model of how this pump would go. And so this is the pump that's delivering the fluid, and it's going into a reservoir here from which we measure the weight, and then we can measure the delivery at which that fluid is coming through. And then it's sucked back with a spectrometer for detecting VEGF levels. And then it's controlled basically by this internal control system that allows this system to be directed in and out. And we're in the process of miniaturizing this system here, but eventually what we're envisioning is basically that this system will have, here's the tumor, but it will basically be having a pH sensor, a pressure sensor, pump, flow sensor, and then these are the valves that are involved in terms of delivery of the chemotherapeutic agents. And this is basically a schema of the whole process as it will occur. Basically, the pumps will deliver chemotherapy to the brain tumor. This fluid will then be sent back. We'll be able to measure VEGF levels. We'll be able to measure pH, oxygen, and also pressure. And so what type of drugs to place? What we want to emphasize is that basically we're building a device with delivery that's going to be reliable and accurate. But it's really your imagination in terms of what you want to place into it. We have thought about basically drugs like Avastin, irinotecan. Topotecan was recently reported has been successful in a phase 1/2 trial at Columbia with the AANS this year. And then the interleukin-13 toxins, or IL-4 toxins, or diphtheria toxins, which have been used in the past. This is an example of what could happen. This is a pure preclinical translational model. But what we have here is that these are new mice that have been implanted with U87 cells. And what you can see is that control mice die when they're treated with Avastin and Avastin alone, CPT11 alone, and then combination of both. And this is IV Avastin, intraperitoneal CPT11. And when we give intratumoral Avastin, you see how the survival curve is slightly prolonged. And this is intratumoral Avastin plus intraperitoneal CPT11. So in conclusion, basically what we're looking for is a brain tumor pump, which can be used for both resectable and unresectable tumors. This pump is not to replace systemic therapy. It's only to improve local control and should be part of a multidisciplinary treatment. The unique aspects of this pump is that we're going to have physiological feedback on our treatment progress via lab and chip parameters, and then Wi-Fi control of multiple agents for cycle delivery. Our next step, basically, we're halfway through the miniaturization. We're going to be implanting into animal studies, and then partnerships with pharmaceutical companies for further development. And I just want to thank our collaborators at Pharmaco-Kinesis, including Josh Shekar, Frank Adele, and the technical team of Winston Wu, Brad Jordan, Kyle Zimmerman, and Moran Sir. Thank you very much.
Thank you very much. Since you used all the discussion time, I don't think we have time to discuss. Maybe at the floor, please. So we'll go to the next talk.
Next topic is intracerebral administration of CpG-OD for patients with recurrent glioma, glioblastoma, phase 2 study.